So welcome back, and let's go through what happens if you need to be hospitalized for COVID. When somebody has COVID, it might affect their lungs, or you might have a cytokine storm where all of the organs in your body are being affected and it's attacking your organs. So you probably have breathing difficulty and you need oxygen. Sometimes they just take you to a ward, and sometimes you might need to be on a ventilator. So let's go through the procedure. If you go into an ambulance, if your a family member or a friend calls an ambulance because you can't get to the hospital, they will come and everything will move very quickly and very impersonally, if you can call it like that. They'll probably put an oxygen mask on, which looks like this. And it might feel like you're suffocating, but actually through the top here and through the pipe, they're giving you oxygen. It might be a pressured mask. And in some cases, patients are actually ventilated in the casualties or before they get to the ICU. So what happens then? Your family members can't go with you, but they are very important because you need to find out what you're allergic to. You need to give information, contact information. Who must they phone to when you're better to come and pick you up? If there's a problem that they need permission for a procedure, for example, if they need to do bronchoscopy, or something similar, and they need to stick a pipe into your lungs, you need to actually have permission, somebody who can give permission for that. So it will be a mom or a dad if you're under 18, a wife or a husband or a friend, yourself, or a brother or sister that might have got permission for that. If there's nobody to give permission, then they normally get the head of the hospital to do that, or they might get a judge, or there's not much time to do that, but there's normally the head of the hospital has the authority to do that. Okay, so let's go. If you get picked up in an ambulance, you go to the hospital. You probably are going to go through a separate entrance away from people, and they're tending to put plastic covers around people so that you can see out, but you aren't infecting anybody else. And at this point, you might be able to breathe better. Let's go through the procedure. They take you to casualties and then they might ventilate you. So what is a ventilator? A ventilator is a machine where they will put a metal object in your mouth just to put your tongue down a little bit. By the way, you can't swallow your tongue, it's impossible. That's rubbish. So they put it into your tongue, just to put your tongue down, and it's called a laryngoscope, and it's got a light. It shines a little light down, and then they put a tube in. While they're doing this, they normally will sedate you a little bit because it's the very uncomfortable feeling. You might feel like you want to vomit, and you probably will fight them because you can't breathe anymore. So they probably will sedate you. So expect them to put a drip in to your arm, normally in this area, into your elbow or into your hand, and then they sedate you. So you might be out of it for a little bit. The medication they give you is often something that will make you forget. So you might come around and say, what the heck just happened to the last few days of my life? It's just because of the medication, which is probably a good thing. So when they put the pipe down your throat, if you are not fully sleeping, count or keep yourself as calm as humanly possible, because it helps them to get the lung in, and as soon as the intubation done, and as soon as that little pipe is in, you'll be able to breathe a whole lot better. So the ventilator pushes air into your lungs. It pushes it at a certain pressure, and then a certain oxygen level, and then a certain rate. So they're measuring all of these things to make sure that you are okay for oxygen levels. They'll also put a little monitor onto your finger. This is called an oximeter or a saturation monitor. What this does is it picks up the arterial flow in your finger. So the thumb is quite a good place to have it, but the arterial flow, and then it sees how much oxygen you have, and the best is, 98, 100%. Over 90% is fine, but then it starts dropping as soon as your lungs are not able to get the oxygen into your bloodstream. So why does our oxygen level drop? That little bubble called the alveoli sac, when it opens and closes like this, around it is a lot of blood vessels that are just moving past it, and the oxygen is a high concentration inside and a low concentration outside. So the oxygen moves into your bloodstream. The carbon dioxide, being a high concentration coming from the body, comes out of the bloodstream into a low concentration inside your alveoli sac and then gets breathed out. But now, if that is covered with mucus or if it can't move, the oxygen can't get through and the carbon dioxide can't get through. So your carbon dioxide in the blood starts increasing, changes your acid-base levels, can make you go unconscious, and, well, basically you're suffocating. So it's very important that we can get that sac. So the ventilator is pushing the air and the oxygen into your lungs to get through, and then hopefully, and then over time they start reducing the percentage of the oxygen level, the strength of how much pressure is going in, and the process is eventually, hopefully after a few days, that you take over the breathing process yourself. So what are you going to see around you? If you are family or friends of the patient, could be pretty hectic. You might be confused, you'll be in shock, and they're going to ask you a whole lot of questions. What you need to know is, like I said before, allergies. Are there any problems that this patient normally has, and is there any chronic medication? So that means, are they diabetic? That's very important. Do they normally have blood pressure tablets? Do they normally have heart tablets? What is the norm that so that they can carry on giving that medication, and it gives the doctors a lot of information to help assess your family member or your friend. Are they allergic to anything? So, for example, if they're allergic to penicillin, even bee stings, and anesthetic, if there's any time that they had a problem with anesthetic, the doctors or the paramedics need to know this, and they write this down. They need to know how much the person weighs. So roughly, they would have probably complained about their weight at that point. At some point, say, okay, you know what, they're 68 or they're 85 or whatever. They can approximate, because medication is given, especially anesthetic, is given according to your weight as well. And then also any valuable history. So they need to know contact information, and they'll need a contact person that they can phone. So contact phone number. So in the olden days, we used to remember all the numbers. You might need to get your cell phone ready. Please don't take any valuables unless you're wanting to donate them to cyberspace and to lose them. Please don't send any valuables to the hospitals. In the hospital, they have got hospital gowns that they wear. And if you need to send clothes, they will tell you. But take off all your rings, earrings, jewelry, watches, and even cell phones, unless they're going to go to a normal ward where they can keep a cell phone next to them. I suggest that you don't send any valuable items with them. You probably won't be able to visit them, but you can phone the wards up. Don't bug the sisters too much or the nurses too much, but phone up once a day. It is very important that the patient knows you are looking after them and you're praying for them, and that you also know that how they are doing. So you can find out how often or when you can phone and find out about them. So what the sisters or the staff are doing at the moment is, during the COVID, because you can't connect with your family, they're doing WhatsApp calls every now and then you can at least just see that your family member is okay. The next important thing, if you've got a medical aid, you need to contact the medical aid and just say this has happened, and then ask them the process going forward so that they are aware of what's happening. The hospital will also do this, but you will also need a copy of their ID and their medical details. For a public hospital patient, you obviously won't need that, but you will probably need just a copy of their ID. It just helps to identify the person and helps to follow up. So I hope this has been very valuable. There is one thing, that when you go in as a COVID patient, suddenly people will be walking around like Mars men around you. They don't come from Mars. They actually just are wearing their scrubs with a theatre gown for keeping bugs, for protection. Probably a mask up to here, and possibly a face mask just so that they can see. There's very little human contact, which is actually very sad. It's one of the biggest things about COVID. So the touching and the communication, and that has been reduced because of the risk of infection. So the hospital job is to protect the patient, so they don't want to cross-contaminate. So they'll have a jacket for one patient, and then when they take that off outside that patient's room, and they'll have another jacket for a different patient. So they won't take one patient's jacket and use it for multiple patients, but they'll have a different or a plastic apron. And in ICU, it's a very cold physically cold and maybe emotionally cold, but they try their best to be as personal as possible. But you'll see a lot of bright lights. You probably won't know if it's day or night. There might be clocks around and you might be confused. So in those times, if that does affect you, and if you can remember what I'm saying now, I want to just leave a verse with you. It's from Psalm 46, verse 1. God is our refuge and strength, an ever-present help in trouble. You must know that you're never alone, and that if you are part of a church or even connected to someone who's part of a church, you've probably got a whole prayer group backing you, and then you're in the best hands possible. Right, when you come out of COVID, if you come out of the hospital in between wards, they might be wheeling you to x-rays or whatever. They cover you with a sheet, and that is just so that you can still see out, but it's just a protection thing. When you come home, you won't be infectious anymore, but you need to rest. The post-COVID syndrome is a very, very real thing. A lot of patients say they are tired, they might have headaches. Take the medication and rest, and remember to do your lung exercises. Cool. So I hope that has been helpful, and that you've got more information. Maybe one little aspect you can use for somebody else. And yeah, see you in the next video. Thanks. Bye.